Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Then, JNC 8 criteria. According to the JNC 8 criteria, okay, in JNC 8 criteria, we have a important thing. So, in any person whom you have suspected that their patient has hypertension, in this JNC 8 criteria, first and foremost, you should ask the person to undergo exercise modifications, diet modifications, ask them to weight loss and to quit alcohol. So all the lifestyle modifications are first advised. Even after lifestyle modifications, if the BP is not decreased, then there are two things here. One, you should see whether the patient has diabetes mellitus and chronic kidney disease is present, or if the diabetes mellitus or chronic kidney disease is absent. Now, if the patient does not have diabetes mellitus and chronic kidney disease, then you should see the age of the patient. The age of the patient is more than 60 years, or if the age of the patient is less than 60 years. Now, if the age of the patient is more than 60 years, then you should see the blood pressure. The blood pressure is less than 150, or the diastolic blood pressure is less than 90, and if the age of the patient is less than 60 years and the systolic blood pressure is less than 40, or diastolic blood pressure should be less than 40. So this is actually the goal. Okay, so the goal of the patient for those for non-diabetic patients with more than 60 years is but the blood pressure should be bit less than 150 by 90, whereas for a non-diabetic and non-CKD patients of age group less than 60 years, in them the blood pressure should be under control to less than 140 by 90. Okay, the blood pressure control should be less than 140 by 90. Then in all other ages, in all other ages, okay, so this is if the diabetes is present, absent. Now, if the diabetes is present or chronic kidney disease is present, then all ages with diabetes present but CKD absent, in them again the systolic blood pressure control should be 140 by 90, 140 by 90. Then for all ages with CKD present, in them also the goal should be 140 by 90 only. So this is not the goal, this is the goal, not the blood pressure of the patient. The goal should be 150 by 90 for patients more than 60 years. For all the other patients with less than 60 years and those with diabetes mellitus or CKD, in all of them the goal is to keep the blood pressure less than 90, 140 by 90. Now in these three groups, if there is no CKD, if there is no chronic kidney disease, if there is no chronic kidney disease, then we should see whether the person is a black race or non-black race. If the person belongs to black race, then we can give thiazide diuretics or calcium channel blockers are given. If the patient belongs to non-black race, then we can give ACE inhibitors or ARBs or CCBs, calcium channel blockers or thiazide diuretics, and all the combinations can be given. Now, if the patient has chronic kidney disease and he is of any race, all the races we can give ACE inhibitors or ARBs are given. So this is JNC criteria 8. So according to this JNC criteria 8, the main thing is no stage of hypertension. There are no stages of hypertension. In GNC 7, we have stages of hypertension. But here there are no stages of hypertension. Treatment is mainly based on the target. Here the treatment is based on the target blood pressure. Now, the target blood pressure is always 140 by 90 except in elderly patients where the blood pressure should be less than 1, where the target blood pressure should be less than 150 by 90. That is the thing which we have seen here, right? Only in elderly patients who are more than 60 years, in them the blood pressure target is 150 by 90. For the rest all, it is 140 by 90 only. Then, now according to this JNC 8, beta blockers are not the first line anymore. So the first line are only ACE inhibitors. Here I have never mentioned beta blockers. So according to this JNC 8 criteria, beta blockers are not the first line. They are not the first line drugs. Then, yeah.
Thank you and thank you for watching.